An aneurysm or dissection of an ascending aorta can rupture or prevent aortic valve leaflets from closing properly. The goal of resection is to repair the aneurysm and restore function to the valve. An aortic aneurysm is potentially life-threatening. The walls of the artery distal to the blockage become weak and distended. A saccular aneurysm is a ballooning of a localized area of an artery, and a fusiform aneurysm is when the entire circumference of the artery balloons out. The ballooning vessel begins to delaminate, which means a separation of the artery layers. This delamination is called dissection, and the aneurysm is then referred to as a dissecting aneurysm. Very simply stated, an aneurysm of the ascending aorta is repaired through a median sternotomy incision. A cardioplegic solution is used and the heart is put on bypass machine. The aorta is clamped distal to the aneurysm and the aortic wall is open. The graft is anastomosed to the proximal and distal aorta, and then the aorta is unclamped. The bypass machine is stopped, chest tubes are placed, and the wound is closed. An aneurysm of the aortic arch can impair blood flow to the brain and upper body because it impairs blood flow to the brachiocephalic artery, the left carotid artery, and the left subclavian artery. Endovascular repair is now frequently used to treat the descending thoracic aortic aneurysm. The basic method is the same as with an open aneurysm repair, to clamp the aorta and insert the graft. Cardiac ablation is a selective destruction of diseased conductive tissue to correct atrial fibrillation. This ablation can be done with radiofrequency, RF energy, or cryoenergy. This creates scar tissue to force impulses to follow an alternate pathway to restore the normal heart rhythm. It can be performed by electrophysiologists. Cardiac tamponade is a compression of the heart created by fluid in the pericardium caused by inflammation related to an infection or tumor. Removal of the accumulation of blood or fluid in the pericardium to improve cardiac function is called a pericardial window. A ventricular assist device is used for patients waiting for heart transplant. The VAD maintains perfusion through cannulas placed in the chambers of the heart and the great vessels according to the patient's needs. Heart transplants are performed because of a diseased heart from coronary artery disease, congenital heart disease, valve disease, or rejection of a previous transplantation. Heart procurement is from when the donor and the heart is given to the recipient. The recipient heart is not removed until the donor procurement team has confirmed that the donor heart is acceptable. There are two types of transplant. An orthotopic is the replacement of one heart with another, and heterotopic is where the recipient's heart is left in place and a second donor heart is inserted into the recipient's patient's right pleural cavity.